to another developing story. The Frontiers Healthcare Services has raised an alarm on the increasing number of positive COVID-19 cases being recorded at the Kotoka International Airport. In a letter addressed to the Managing Director of the Ghana Airport Company Limited, Yao Kokwa, and copied to the Ghana Health Service, the company responsible for Ghana's COVID-19 testing at the KIA appealed to all stakeholders to stipulate the quality of PCR testing acceptable for entry into the country. According to the Managing Director for the FHS, Dr. Kujo Sendia, these and other stringent measures, when enforced, will avert any looming health crisis in the country. But what impact, if there are, could this have on air travels in and out of Ghana? Sean Mendes is an aviation expert and he joins us via Zoom. Sean, we're so grateful that you joined us. First of all, I mean, this is much more troubling. Of course, the management of the airport company is under pressure to ensure more stricter PCR testing. As an aviation expert, how dark could this situation be?
Well, for starters, I think that the situation is really not as bad as some people may be making it out to be. Ghana is one of the only countries in the world which requires a two-step protocol, and that is a really robust protocol which requires that someone must be tested before departing, but also, and most importantly in this case, they are tested immediately upon arrival. And that ensures that people who may have contracted an infection after they tested 72 hours prior to departure, people who contracted an infection during the flight, or people whose tests failed or who have fake certificates or for whatever reason are caught at the airport. The fact that you are seeing 75 cases actually caught at the airport and not being caught in the community with a large spike of infections there is showing that the system actually works. So I think that the first thing is that people, certainly there is a matter of concern to see these large numbers there, but it's not a matter to be completely worried. If you are catching people at the airport, that is a good thing. That means the system is working.
But I think the challenge now is with the value chain. Those coming in seem not to be complying with the specific guidelines that have been rolled out for them. You rightly stated that some of them coming in with fake, test results and whatnot. Does this call for a stricter compliance? Because this is what the FHS is calling for.
No, absolutely. And this is not a problem unique to Ghana. It's a problem that you're seeing all over the world. I mean, Ghana is not unique in reporting this kind of issue with a lot of people showing up at the borders now with questionable test results. And I think what we are seeing now is progressively that there are more and more digital health verification systems coming out. And I think it may fall upon the government of Ghana to have to mandate that one or multiple of these, whether it's the IATA travel passport, whether it's the Africa CDC Trusted Traveler Initiative, or one or multiple ones of these will become a mandatory test that has to be provided. You can't just bring a piece of paper from Uncle Joe's Laboratories Private Limited. You're going to need to have it from an authorized lab, and a lab which is able to provide real-time verification that your test results are legitimate and that they were taken at a certain time and that the result document you're presenting has not been tampered with.
So therefore you are calling for more layers to be placed on the exact requirement in terms of an international best practices. But moving forward, how could this development impact? I mean, how is it already impacting travel, air travel, not just in Ghana, but across the world?
Well, I think that countries like Ghana, and as I said, there's a very small handful of countries which have taken on a double test protocol without quarantine. So that's where you test in advance as well as test upon arrival. And I think countries like that have seen that this is a very good balance that has been found between keeping your borders open on one side, but at the other side, not allowing imported infections at a rate higher than your local transmission. So it's Ghana, the system in Ghana has actually worked well. So the solution is not necessarily going to be to change the system, but rather to see where the system is being probed by potential weaknesses and to tighten up on that. And right now what you're seeing is the system is being probed primarily by pre-testing failures. The pre-testing failures can be addressed through multiple means. I mean, for example, the UAE has a list of specific labs only that they will accept test from if you are coming into the UAE. So in every country, pretty much around the world, they list at least 1 or 2 labs there. And Ghana could do that. Ghana could say that if you are coming from Nigeria, we will only accept from the following 10 labs. If you're coming from Sierra Leone, you've got to come from this. If you're coming from Dubai, you've got to present a test from these places.
All right.
And that could be one way of doing it. But I think we're living in the 21st century, and I think with the advent of apps and smartphones and the ability to use digital technology to verify test results in real time, I think the future is going to lie in something like that. And Ghana has already introduced that for outgoing travelers, that all outgoing travelers now have to use digital test results from specific labs. I think partnering or even adopting one of these from an agency like Africa CDC or IATA would allow Ghana to very quickly be able to have a digital verification program in place without necessarily having to shut borders or add too many troublesome impediments in the case of inbound travelers.
Sean Mendes, we're so grateful for your analysis on this particular development. He's an aviation expert helping us understand the concerns regarding the high cases of COVID-19 results at the Kotoka International Airport.